Okay, so in preparation for my wound assessment, I'm going to start with washing my hands with soap and water and dry my hands. I'm going to put my gloves on and remove any dressings that are covering the wound, and then note the type of dressing that was on it, and if there was any exudate on the dressing and the amount. I'll then irrigate the wound and check for any odor that is present and the amount of the odor. Location of this wound is on the lateral malleolus of the patient's right lower extremity, and it also extends a little superior to the lateral malleolus. The wound size, I measured it as a direct measurement. I'm going to try to do this with one hand. I'll start here. I'm going to take the longest. No, I'm going to turn this around first off and get it in the right measurements. In centimeters, I'm going to take the longest length of it, and I am at about 7 centimeters there. I'm going to go perpendicular to that and then measure it. And for that, I'm at about 4 centimeters there. So the total area for this is going to be, total surface area is going to be about 28 centimeters. The depth is not included in this because it's 2D, and it does look more superficial, but I would, if I needed to document that, I would put less than 0.1 centimeter for like Medicare purposes, unless I could get a definite measurement of it. As for the tissues present, it does look like there is about 60% yellow, 40% red, and 0% black. You can see that the slough is adhered, and it is a whitish pale yellow located in the periphery of the wound and partially scattered throughout some of the red tissue here. You can note some of it up here as well around the periphery. And then the red, as for the red, there's about 30% that's that dark beefy red. And then you've got about 10% of it that is that lighter dusky pale red. And there is no undermining tracts or tunnels noted in this wound, but it's hard to tell again because it is a 2D image. As for the wound edges, the wound is well demarcated. You can see the edges really good. It is attached. It does not look like it goes really deep. It does look like there might be a possible epibole, but I'm not really sure from this image, but possibly it looks like it might be rolled under a little bit. There is no hyperkeratosis or any kind of fibrotic tissue present. Epithelialization is present around the wound edges. You can tell it does have that red color on the periphery at the edges. And the wound itself does have that circular edge going around the wound itself. It is a circular wound. As for the peri wound, there is significant dark pinky red noted in the peri wound area, more of this area right in here. It does extend more inferior on the right lateral malleolus, more so than it does superiorly. There is more in this area. There is a part of the peri wound, there is that darker area over here that is located at the 4 or 5 o'clock on the right lower extremity, and it is a darker red. Now, the peri wound measurements, again, I would measure it here with the longest area for a direct measurement. So I'm here. It looks like it's about, hard to tell with this picture, but it looks about 12 centimeters there. And again, perpendicular, and I'm going to measure it. And I would say it's probably here. It looks like it's about 7 centimeters there. It does look like the peri wound has moderate to high amount of exudate. Looks like the skin is weeping right here. I would definitely want to note that. And it does look like it's a serous color. It doesn't look like it's really sanguinous or nothing like that. As for the type of wound, this patient's presenting with a venous wound. I determined this from the hemosiderin staining that is located on this patient's leg. It's really noticeable up here in this area. Also, there is that exudate on this patient's right lower extremity, which is a good sign as well. And there is a lot of edema in this patient's lower extremity as well, which is common for a venous wound. And the location of the wound, it is on that lateral malleolus. And again, that is very common for a venous wound. Thank you.